Good morning to ladies and gentlemen and welcome to the forum today. First of all, I would like to thank to all of the audience. Thank you very much as all of you willing to devote your time to join our discussion in front of the television. Our issue today is changing roles of pharmacy in future 10 years. Well, let me introduce first the panels today to all of you as they are all the professional people from different fields. They are qualified and having high knowledge and experience about the topic that we will discuss today. Right on my left is Ministry of Health, Ms. Tan Mei-jun. Beside her is the Ministry of Education, Ms. Sarina, and the most left is Ms. Hyunga Chin, a doctor from Hospital Jati, a government hospital located in Pulau Pinang. Right from my right is Ms. Lau Kim Sim, which is a foreign hospital pharmacy from Poland. Beside her is a local hospital pharmacy, Ms. Jen Kaur, and the most right is Ms. Tan Daphne, an industrial pharmacy. Welcome to our forum today. With me, Uizue as your chairperson today. Nowadays, pharmaceutical, healthcare, and medical field grows rapidly in all over the world. Besides the physicians, the doctors, pharmacies also become more important and more needed by the societies. The development of pharmacy profession in Malaysia can be proved by the increase of the number of pharmacists needed in different fields. In 1955, there are only 40 until 50 pharmacists available in Malaysia. As time goes by, the number of pharmacists keep on raising up to 4,000 until 4,500 in 2006, and now there are 400 pharmacists being registered yearly. What is actually a pharmacist do? As your information and based on what all of you have observed, pharmacists usually work in a shop or a hospital to dispense drugs and medicines, or else work in a pharmaceutical company. That's all. So, are that the only things a pharmacist can do? And today's topic, that is what we wish to discuss. With the professional knowledge and practical, how can the roles of pharmacists to be modified or change in these future 10 years to follow the pace of this era globalization to improve the quality of life in the society. To start our discussion today, I would like to seek an information from the first panel, Ms. Tan Mei-jun, the Ministry of Health, which is on my right side. Ms. Tan, as the requirement for pharmacy in medical field keep on increasing in Malaysia, can you please tell me about what is the opinion what can be changes for the pharmacist roles for the future 10 years?
Yes. Nowadays, developing a healthcare system that put people at the center of their own care and uses all available resources as effective as possible has become a consistent goal. Government must work with all key professional groups to use all available resources of the system most effectively, and importantly, pharmacists must be recognized as the professional that coordinate drugs therapy management. In my opinion, in future 10 years, pharmacists should be the experts in the drug therapy management. The pharmacist assesses each patient through observation, dialogue, and considerations of clinic indicators. In care plans, the pharmacist creates a plan in the consultations with the patients and when necessary. Other members of the healthcare teams, the pharmacist monitor the patient's compliance with the response to drug therapy through regular follow-ups. Yes. Besides, pharmacists should be a part of the person-centered care. Key barriers must be overcome to shift from a mindset of getting the right drug to each patient to getting the drug therapy right for each patient, and to reap the benefits of fully integrating a pharmacist into a person's care team. It has been reported that 70% of hospital beds are occupied by people with chronic illness. Pharmacists are repeatedly asked to cooperate in care delivery and are doing many fronts, but inclusions of pharmacists in government's model for care delivery has been limited. Similarly, at the local level, community pharmacists need to be more involved in primary care teams.
Thank you, Ms. Tan. So we know that pharmacists also play roles in drug therapy, management, and also person-centered care, as what you told, right? Okay. Ms. Wei, I would like to ask you a question. Do you think education is important to prepare pharmacy to cope with the change of roles in the future 10 years, and education plays the roles?
I think that as the roles of a pharmacy changes from persons that are responsible for dispensing drugs to a more patient-facing roles, either in community or hospital, pharmacy, and more focused on the medicine development. So as the Minister of Education, I know that in order for these changes to take place successfully, education plays an important role as to provide the excellence and skilled pharmacy. So as a pharmacy has changed from a drug manufacturer to a healthcare provider, he or she is the primary source of drug-related information to a patient. So the education is now highly focused on increasing and improvement of the program that enhance the problem-solving skills. So they have to be rich in the academic knowledge, combining the intensive curriculums with clinical orientation. They have to consult correctly and give the exact amount of drugs to the patients in the right dosage and frequency. What we can learn from the other country is like Pakistan is that to incorporate the whole rational drug modules in the final years of doctor of pharmacy curriculums. And besides, as the Ministry of Education, I realized that the education has changed from a traditional lecturing styles to a more modern theme-based learning for the pharmacists of tomorrow. So the pharmacy students now must fill with the academic knowledge as well as focus more on the research projects in the development of new drugs. This is due to the possibilities in the arising of the various kinds of disease in the durations of 10 years, and also the change of roles of pharmacists in the medicine development. Pharmacy students are able to learn the different skills that are required for the modern pharmacies, including the teamwork, problem solving, and time management through these research projects.
Okay, thank you, Ms. Wei. So I can really feel the importance of the practical skills and knowledge inside a future pharmacist. The problem-solving skills is stressing to prepare pharmacy to communicate and solve the problem that they face. Okay, wow. Okay, Miss Tan Daphne, good morning. And can you clarify for us about the changing roles of pharmacists in your field?
As an industrial pharmacist, I would like to explain that what is my job about and what I do. We involve in the discovery and development of safe, effective drugs. We can work at any stage of the process, including research, development, clinical trials, quality testing, and even marketing and business development. We also will be using the latest technologies, methods, processes to develop new medicine for patients. In my opinion, the role of pharmacists today is different in the future 10 years. Pharmacy is changing rapidly, and over the next 10 years will play an increasingly important role in healthcare. At the same time, huge investment by industry in medical research are generating novel treatments and identifying disease mechanisms. Drugs are becoming more powerful and effective and are therefore more important in patient care. Pharmacists has responded by designing some drugs specific to receptor subtypes, therefore resulting in fewer adverse reactions and improved treatment response and greater safety. The type of products available in pharmacies are expanding. Therefore, the demand for pharmacies will keep on increasing in the future. Besides that, where all pharmacies providing pharmaceutical care will be independent prescriber in the future, working in collaboration with doctors who will continue to have overall responsibility for diagnosis. Pharmacy will bear responsibility for the initial assessment of patient to inform the choice of medication, as well as the continual monitoring of the clinical performance and side effects of the medicine, making adjustment to dose and drug to optimize their safe and effective use.
Okay, thank you very much. So we know that industrial pharmacies also contribute to in generating novel treatments and identifying disease mechanism. So, Ms. Hugh, what is your opinion on the changes of roles of pharmacy in medical field?
Well, I'm a physician, and I would like to start off my point of view with a statement. Pharmacists have the biggest opportunity to impact healthcare in the next decade. According to history, healthcare has been physician-patient rule, whereby in Malaysia, the physician is responsible in examining patients, taking medical histories for the respective patients, prescribing medications, despite ordering, performing, and also interpreting diagnostic tests. On the other hand, pharmacists are just in charge of preparing the drug dosage as determined by the physician, dispensing the medication to the patients, and managing the patient's drug-related problems by counseling them. This can be supported by a survey carried out among pharmacists and physicians, where they were asked to indicate the extent to which each of the tasks were components of their role. There was a high level of agreement among the pharmacists that all tasks were important, although assisting in medication insurance claims ranked the lowest. A huge contrast can be seen whereby the majority of the physicians do not agree with the roles given, and this is indicated by the lowest ranked role in the survey. These roles include assisting in medication dosage adjustment, providing information to physicians to aid in selecting medications, and providing advice on how to manage a drug-related problem. As years pass by, the role of a pharmacy profession continues to evolve from a focus on dispensing medications to taking increased responsibility for and facilitating optimal medication use through collaborations. I firmly believe that in future, local pharmacists will be given the ability and opportunity to prescribe the appropriate medications for the diagnostic that a physician provides. This can be supported by having a broad understanding of the scientific principles and techniques of the pharmaceutical sciences, and also the ability to keep pace throughout their careers with the development in medicine and pharmacy, where their knowledge and expertise extends to all aspects of the preparation, distribution, action, and also the uses of drugs and medicines. With this, physicians can free up more time to go and more in depth with their patients on other issues, such as patient counseling. In fact, the increasing complexity of medication therapies underscores the need for the strong working relationships between the pharmacists and also the physicians to optimize the patient care.
Okay, thank you, Ms. Hugh. So, it's clearly seen that pharmacists also will cooperate with the physicians to prepare and distribute the drugs based on their knowledge, such as the actions and uses of the medicines. Okay, hi, Miss Jane. As a 5 years local pharmacist, what is the modification of roles of the pharmacy when facing all the challenges in Malaysia?
As we know, in an environment of increasing public expectations, workforce pressure, and the significant scientific and technological advance, it is important to define the contributions of the pharmacists make not only to the healthcare team but more widely. So, as the local pharmacist, I would like to say that without clarity on the pharmacist's role, we cannot effectively select, educate, and train pharmacists or plan for the future pharmacist workforce. Although taking on new role can be enriching, there is also a danger that a profession can lose its face or worse, lose its identity. The role of the pharmacist must be congruent with the role of others such as doctor, nurse, pharmacist technicians. traditional attempt to summarize the role of the pharmacist through the medicine and the associated information provided. Now the focus of what the role should be for many has moved to that of caregiver by ensuring the high quality use of medicine. The pharmacist may also have generic roles as an educator, manager, mentor, business or service developer, leader, researchman, and so on. The role of pharmacist is changing and will continue to change alongside the needs and expectations of patients or service users. Advancements in technology, social politic changes, the end of difference, greater access to information, and a shift to multidisciplinary working whole means that the way pharmacists work will need to change. Pharmacists need to be produced or adapt so that able to develop their own practice and role to meet changing needs. A readiness to be more actively involved in decision making and take on greater leadership responsibility will sure need to be the core of the role. Pharmacists will also need to be able to move on more flexibility, such as between hospital and community settings, and to understand that their roles will be changed throughout their careers.
Okay, thank you, Miss Jane. Based on her experience, so a pharmacy should be more flexible and clear to cope with their jobs in the future when facing the challenges. Okay, Miss Lau, as a foreign pharmacy, how was the development of the pharmacy profession in your country?
As a foreign pharmacist, I would like to share with you guys regarding to the development of pharmacy service in other developed countries. I'm a pharmacist from Poland, and I believe that all of you have heard of the term pharmaceutical care before. The introduction of pharmaceutical care to the pharmacy practice in all European countries will help to improve the quality of patient care and treatment outcomes, and will lead to a better allocation of available resources. In Poland, the role of the pharmacist does not remain limited to dispensing medicines, despite the continuing efforts of pharmacists and academic bodies. However, we are now putting our effort in implementation and popularization of advanced pharmaceutical services. Besides that, in the future, according to the unanimous opinion of all the parties, pharmacists should prepare themselves for participating in the out-of-hours pharmaceutical service. This service is designed to improve patients' access to care, for instance, provide access to advice and dispensing of urgent prescriptions and oxygen. Hence, as a pharmacist, we need to prepare ourselves to be more committed in fulfilling the needs of patients in the future pharmaceutical service. Moreover, a future development of the service is to introduce a pharmacy equivalent of the general practitioner (GP) out-of-hours cooperative. This would involve establishing a pharmacy at the accident and emergency department at a district general hospital, run by a rota of local pharmacists. It would act a bit like a walk-in center with a nurse triaging patients and then streamlining them to accident and emergency. So a GP, a nurse of the pharmacy. In a nutshell, indubitably, pharmacists will play a more vital role due to development of pharmaceutical service. This is in order to deliver a better therapeutic care to all the patients in need.
Okay, thank you, Miss Lau. Based on what she has stated, besides the usual pharmaceutical care, pharmacists can also participate in out-of-hours pharmaceutical service in future, which is this service is designed to provide more care for the patients. Okay, thank you everyone for sharing the useful information, and also the audience that's spending your time with us. Okay, here come to the ending part of our forum. And thank you and have a nice day everyone.